Township.
Good morning, everybody. My name is Michael Lapola, Acting Township Manager. These are departmental budget hearings in which the various department heads make a presentation concerning their budgets and budget requests for 2024. While the public is invited to attend these meetings, there is no public participations or questions at this point in the budget process. Our first presenter will be the head of the Health Department, Amy Monaco, and I'll turn it over to Amy.
Thank you. Good morning, everyone. So I'm going to go through each division because, as you know, health is divided into public health, the kind of the core public health, senior services, sustainability, the animal shelter, and I think that's Section 8. Thank you. I'm like, I knew there was a lot. And so I'm going to first go through operating expenses, and then I'll talk about salary and capital. So for the core public health section, we're looking for an increase of just under 30,000. 5,000 of that is for mesh services, because I know there was a discussion at the council meeting about increasing what we give to mesh, so I built that in just in case we go in that direction. If not, it's, going to be roughly then, $25,000 increase. So a lot of the things that have increased are going to be things like printing, supplies, mileage. Some of this is due to the fact that we probably won't have the grant funding that we had in past years. And then some of it's just due to inflation. Everything's costing more. I increased the, within public health, the core public health, we have sustainability. That's Lisa Johnson's office. And I increased her line from $12,650 to $3,000 for any initiatives that are not grant funded that she's working on. Let's see. The mileage issue, it kind of ties into the capital. So we're down a vehicle this year, and so we're using more of our personal vehicles for work out, work-related trips. And so I wanted to increase the mileage from $75 to $1,000. And then there's some other things like physician fees, the rates of the contracts. This is for our standing medical orders. We have a childhood lead prevention program, and we have doctors come in to do the blood work, the venous blood draws, and that's also increasing a slight amount. So that's really core public health in terms of operating. Any questions about that before I move on to the next?
Yeah.
Sure.
We no longer have shared service agreement with Nutley.
As of December 8th, it will be gone. Yes, right.
Okay. So we are no longer going to have shared service agreement with Nutley. So how does it impact? So you're not going to provide services to them. So all the, whether you are doing it through health officer or environmental officers, those expenses are to proportionally reduce because we don't have this additional service. And similarly, mileage to go to Nutley and provide the services.
Right. Well, we weren't doing, the way the Nutley contract was set up, it was really just supposed to be for having the health officer, because they had their own nursing staff, they had their own inspector, and that's why it was a smaller contract, because it was really to have the health officer. Occasionally, Bob would go just within the last year or so to help support the one inspector because he needed some additional support, but the nurses wouldn't physically go there. That was more like if they had questions or there was a question about an outbreak or they had a question for me about how to handle something. But it was minimal, it was really minimal time and effort compared to Verona or Cedar Grove because they don't have any of their own staff that do any of that work.
I recall saying they are using a lot more of our inspectors, and there's regularly questions from the public that come to our office. That's
Right.
what I remember having discussion with Keith before you came. I guess that's the reason that it's not worth it for us for the amount of time we are spending there.
Right. I mean, maybe in the past they had more needs. Like I said, since I've been here, which is just since March, Really just that one inspector who does all his own inspections, just needed some additional support. So Bob typically, would answer questions, maybe review some, reports with him. But amount of time spent there was very negligible. So we don't see that much of a shift in terms of, kind of people power or,
What was the
even
cost of
time.
that contract?
It was under 50,000. It's pretty, right?
It's
Marcia,
very
do you have the
little.
exact?
Yeah, under 50,000.
Yeah.
I have it on.
So it was small, and again, that's why it was really just for health officer coverage. Sometimes they didn't have like, for instance, they didn't have their own lead machine. So if they had to do any like lead inspections when there's an elevated blood lead level, they would, use our machine. So they're going to have to, figure out who they're going to get the machine from. But
Was the decision ours or theirs? Or
it was
mutual?
theirs, right? They decided they wanted their own health officer, and so they, hired somebody.
Okay.
Yeah, it was,
All right.
We had started talking to them, and then
I don't know if this is the right time to talk about this, and I don't know if it's a budgetary issue or just a,
Right.
with our, all the issues involving our unhoused population and
Right.
people trying to coordinate all of the services, and
Right.
I know you and I have
Yeah.
communicated on numerous times about situations where you have to be involved, but also, the police department's involved, MESH and other groups are involved.
Right.
What do you see as the way we figure out who's in charge of this coordinated, hopefully comprehensive approach to providing services?
Right. I mean, I think we need to, bring everyone to the table to figure out, what they're currently doing, what we need to do differently, where we can add support with the social worker that we now have. I mean, I think it's mostly been under the purview of the police, where maybe they have the individual move, but I don't think they're linking them to resources. And I think, then it's just kind of a circle, right? Like they go back, maybe they're off the street, but then they go back. Of course, sometimes, folks don't want to be housed. They want to be on the street. And so in that case, there's not much we can do. It's a little bit
I noticed,
trickier.
it's not, I don't want to call it an encampment, but we do have some issues now where,
Yeah, I saw that email
and
last
the
night.
issue also is now people are trying to be helpful, are dropping off supplies and other things
Right,
to
right.
these sites. And so in addition to the, I guess, starts with where the porta potty is and then the tent,
Yeah,
and then people dropping off all this other stuff
Right.
for them, it's a mess.
Yeah, yeah.
So we're trying to figure out what to do, and at the same time, understanding that,
Right.
the weather's getting colder, but
Yeah.
it is a problem. I mean, people are well-intentioned, but it's just creating, a bigger issue. So
Yeah.
I was just curious as to whether or not, it's
I-
not easy.
Yeah, no, it's a
I
tricky.
thought we were looking at Salvation Army, the people came to discuss, remember?
There's a public-private partnership
Mhm.
that Councilor Cummings is the representative here with
Right.
Salvation Army, NASH.
Right, I got into
Yeah.
some of those meetings, right. Monarch did that
and-
assessment, right.
and
Mhm,
Monarch.
right.
They are putting together a game plan along with the
Yeah.
research.
Okay,
Okay, so that's working.
No, I've had several conversations with the counselor. It's just, there's parts of this that we have a legal obligation to deal with on a daily basis, that we're trying to do this until such time as there's, and I don't know if there's ever going to be a solution, but, how do we handle these on a day-to-day basis? And I don't know
right.
if there's an answer. Do you take away the, neighbors demanding you take away the porta potty?
But then
And that'll
where are
stop the
people gonna
situation. I
use
know, and that's why it's not an
facilities, right.
easy, so,
The issue with Ross Park was addressed Thursday.
Yes.
That issue was addressed Thursday.
Okay.
Disabled, ECS is taking disabled away.
Mhm.
And he's taking, because that got untenable because, as you said, people were dropping off.
Yeah, I saw the photos. It was
rather large, yeah.
So it's not easy.
Yeah.
Okay. I was just curious about how we're, it seems to be a growing issue, at least on my desk.
Yeah, no, I think it absolutely is.
And while we are still on this health, I know we don't have much time, opioid money. We got a lot of opioid money. I know initially you were going to work with the county, and I attended several meetings hosted by the county, and now I
Right.
believe you do not want to work with, you want independently, right? You want the township to do the programs independent of the county?
Well, it's not that, it was kind of two separate things. So the county had created this task force.
Right.
Just to talk about what they were going to do if we wanted to give input with their money. And then, not that they were going to take our money.
I thought they were going to take eventually, if the program encompasses every town or can affect every town, I think they are going to pool up all the monies from all municipal. That's what
Right,
my
right.
understanding, that's what
Okay.
many other municipalities across the state are also doing.
Mm-hmm,
So I could be wrong, so.
I don't think anyone's clear on what they're doing with the money. I mean, I think, but what I know is the county is doing this assessment, a needs assessment first, with their money. Then maybe based on that, they'll say, hey,
Are
if
there
you
two
wanna
separate
chip
pots
in-
of money?
Well, the county has their money, and then
Yes.
the municipalities have their money. So we have money separate from the county.
And how much did,
But the rules apply across the board, apply
right.
to
How-
all
Right.
those.
How much did the
Oh,
township receive?
We received $200,000 already, a long time ago. and
Right,
We
right.
we will continue to receive for the next 18 years,
Mm-hmm.
I believe, but not this much, it drips and drabs. Yeah.
Right.
So currently you used it very little for the
The overdose
Narcan
kits.
kits and some goodie bag.
Right, the
I don't know
overdose
whether they call
kits.
goodie bags or not, for some bags. to-
Right, to put the Narcan and the test strips for
Right.
fentanyl and xylazine and,
Yeah.
right, so we get
We-
CPR masks and things.
We need to submit quarterly reports for that.
Yeah, no, we have all the accounting of that. So, I mean, so I'm actually working on a scope of work, and I should have that done pretty soon. I'm gonna work with Al to get that posted, to see, I needed some time to sort of figure out what it is, like, that we wanted to really focus on with the money, where the needs are. So we put out a survey, so we're waiting for results of the survey to see, where the community would like to see the money
Could the money
spent.
be used to maybe not a full extent, but a partial extent, to hire, we talked about a public health educator. You know what I mean? Can part of that money be used to cover a salary? Because I would assume that if you had an educator, a big part of what they're going to educate on would be an issue like opioids. I don't know, because some grants restrict
right.
it. You can't use it for personnel, others you can. I don't know. I've not read the grant award,
I
so.
know other municipalities are using it, but most of them are using it for like a crisis counselor, more like a social worker, part-time.
Right.
Um,
And
which
the
is
prevention
probably-
also, you can use it for preventive measures too. So that's where the education comes, but you have to be really total. The time spent on this program has to be clear.
Right, so we could probably.
I'm
use
just
some of
curious.
it,
I'm just
right.
curious.
I mean, in that case, then we may not want to do an RFP. So
I
we
just
could have a
threw it out
further
there.
discussion.
I just put it out there. It's
Yeah,
not-
yeah.
I
Yeah.
don't have a strong feeling one way or another. I was just
Right,
curious
right.
as to,
Yeah,
know.
I would recommend doing it. So, the quicker, whatever process helps, because
I mean, my
we are
goal
sitting
is-
on that money.
Right. But I really want it to be meaningful. Like, I don't
Yeah.
want to just do something with it
Right.
without really
Correct.
understanding, like, where it's going to make the biggest impact.
we don't need T-shirts that say "Don't do drugs." I understand.
Yeah,
That's
yeah,
not what the
exactly.
money's for.
Right, so the overdose kits, we're doing trainings, how to use Narcan, we're gonna be doing that starting, and then we're gonna give people the Narcan, because to do the training and not have the Narcan.
The preventive part also you'll be doing, right? It's
I'm
before
sorry.
they get to the Narcan stage.
Well, yeah, I mean, right, educational stuff as
Right,
well, right.
right. That's, yeah.
All right, so that's
Yep.
the opioid stuff. So should I move on to senior services?
Yes.
Okay, all right, so operating expenses for senior services, we're asking for an increase of 14,000. Again, some of it's printing, subscription, seminars, and meeting expenses to increase kind of workforce development. And then the mill program. So the township has been giving $10,000, and we get $30,000 from Partners for Health. So we were asking for an increase in that, an additional 10,000 from the township. We've expanded now to Wally Choice 2 days a week, and then the library 1 day a week, so we have 3 more days of programming. And as it is, like, the 40,000, like, I think it's nearly gone for this year, so we really need some more money for these additional days.
Any personnel also? So in senior services, are you requesting any personnel?
A part-time person to help with programming.
We
Right.
already have one part-time, one full-time secretarial, clerical level
Right,
administrative
right.
assistant. One
Mhm.
part-time, one full-time,
Mhm.
and an activities coordinator and a senior services director.
So, right, so let's see. So Judy, Senior Services Director. Then we have Michelle DeWitt,
Yeah.
right? Who's the
Who was there for
court,
you know.
yeah, right. And then she has someone we hired through grant money this year, who just started, Elsie.
Uh-huh.
So we're hoping to keep her because she's been great, 28 hours a week. Margaret Miles, 28 hours, who we had hired, who works both with Judy and Michelle. She's got a different skill set, so she does a lot of technical stuff.
We have Linda Tate.
Linda
full-time.
Tate, right, and then Lizzie, the social worker.
The social worker, is it under seniors or under health, and what is the
Mhm.
function of?
I mean, it's primarily senior focused. I mean, all the calls we've been getting are senior related.
Mhm.
But for instance, right, if we needed to, help someone that was, 40 years old, right, we would still utilize the social worker. But the predominant focus is senior services.
Senior bus, is there any change in that program that we are still going to get the county help?
We are, so the Uber Lyft program will continue, but we're adding some shuttles to try to defer some of the costs because it's so expensive using the Uber Lyft program. We've capped it. People were taking 80 rides a day.
One person.
No, multiple
No?
people.
Oh,
Yeah,
wow.
yeah, there were a whole bunch of people that were like really just overutilizing it. So the county said we can't
Yeah.
keep up with this. So, so now we're adding some buses for food, and some other, maybe then we're gonna add like some, social,
That's a significant help from the county.
Yeah, yeah.
Foster, it's like within
It's like a
quarter,
paratransit
it's done.
Sort of, yeah. So so basically, but the way we're doing it this year is we registered everybody and we verified age and residency. And so that was like a big ask. So we have like 400 to 500 people registered that are using this, pretty frequently. And I think we're getting the cost down, but it's still going to be more than the contract. So I anticipate the contract may go up next year. We haven't even gotten the contract from this year yet. We're waiting for it.
So it's not a
So-
schedule based, people can call and get the service anytime?
So the way it's set up now is they call Judy's office, Senior Services. They, ask for certain things, right, proof of age and residency. Then they get added to this list. The list goes back to Easy Ride. And then they directly call Easy Ride. As long as they're on that list, then they can schedule their rides. But it was becoming difficult for Easy Ride to kind of manage all of that because of the volume. And so now Judy took her months to get that all sort of squared away. But it's in good shape now.
And,
Now, even with
Mhm.
these ridership, our financial obligation has not changed.
I know,
The county will-
it was a
county will
blessing,
put
yeah.
the money in.
Yeah, no,
Yes.
I mean, they've been very generous.
Cost goes up. I think our,
We're still, yeah, okay,
Yeah.
okay.
And with this now, we have the senior programs in different Wally Choice, like you said,
Mhm.
Wally Choice added.
Right.
And so 2, and the library 3. And here is my question. I came to know that we allow outside the residents, seniors from other towns also into our programs. A significant amount, that's what Judy
Yeah.
told me.
She did the stats, right.
So that adds to our need for more space and more,
Mhm. Right.
How do we do that? What's our obligation? And, like, I know the seniors, Judy also asked me, they require more space and they want looking for permanent solution. Clary Anderson was discussed, and I think we had also the designs. I don't remember, but Clary Anderson was where the senior
Okay.
intergenerational
Right, right.
thing was to be built. So, but this outside residents from outside towns, what's their impact on our costs? I would like to know.
Right. That's why we're going to start charging a membership fee for people outside of Montclair starting in January.
What would
Yeah,
that be?
she said that, but with minimum.
Yeah.
I don't know whether it.
Something, a minimum, I think maybe $50 a year or something. But also we prioritize Montclair residents. So if there's a wait list, people that are Montclair residents are going to, have kind of first dibs. So, right, we've had wait lists for a while with a lot of the courses because we don't have the space to have bigger classes.
Right.
You
See,
know,
even
with-
if you charge $50 per year, the space we need.
Yeah,
It's-
yeah. Well, that's why Wally
It
Choice.
doesn't-
We don't have a
it's bigger.
policy that bans out-of-towners, and I would assume that our seniors then could participate in other towns. I mean, normally that's how it works,
Yeah.
but I don't get a sense that anybody wants to stop
County-based,
them
I
from.
thought. County-based services in Cedar Grove, there's a county building for seniors. That's where our residents go.
Okay.
So what's next? on
Okay.
For the seniors.
Is there something
that's-
else, Macho, or?
That's the seniors. Grant funding, you said the grant funding, we are going to lose only the senior services grant. You are not reapplying for that, right?
No, we actually just got an award letter. We are getting that 30,000 from Partners for Health.
No. The county one, the.
Oh, you're talking about the visiting nurse?
Right, visiting nurses.
Right, which is really under nursing and
Ah.
public health, not senior
Okay.
services.
Okay.
So, right, it just, because we don't really meet the taxonomy, the focus is really if you're a licensed home care agency, which
Gotcha.
we're not. So when we go to the meetings, like, there's only, I think, one other local health department that's still there, and maybe they have a home health care license, but historically Montclair did.
Yeah.
And
but
at
the
that
last-
point, we could, offer all the services they want. But what happens is, like, we can't offer, a good portion of the things that they want us to. And then we get dinged in the progress report because we can't, offer that. It's also a lot of paperwork for the seniors, which they are very hesitant to
Seniors.
do. They don't like signing things, like,
Right.
and giving out their social security number, and so that causes them a lot of distress, and so we're still going to offer all the services, the screenings that we do, but without, the additional sort of obstacles, yeah. Okay, so then moving on to animal,
No sustainability, no changes, and personnel, total personnel increase. How many personnel you're asking for increase?
okay, do you want me to skip to personnel or finish animal, and then I can go, what's?
Okay, whichever is.
Okay. All right, so animal, it'll be pretty quick. Asking for a little bit more in shelter supply money for cleaning the shelter, just $400 more. Again, supplies have gone up. Let's see, other, office supplies, seminar and meeting expenses, clothing. Again, this is all because of
Veterinary fee.
inflation. What's that?
These are all little, but
Yeah, yeah.
veterinary fee is like doubling, more than doubling.
Which one?
Veterinary.
Vet fees,
Veterinary
yes. Right, because remember, we had a shortfall this year, and we had to take money from the animal trust
Right.
of about
When we
40,000.
have more animals?
It's a combination of things. So the animal hospital went to an electronic system. So in the past, they would not bill us for things because they would just forget to write them in the chart, or it just wasn't like as thorough of a system, I guess. And so apparently now, like, since they have this EMR, they're billing us for more. Plus, the cost of everything has just gone up.
50,000 more, that's why, more than 50,000.
41,000 extra, yeah,
Oh,
asking for, just, again, based on this year. So hopefully that'll be enough. I mean,
New doctor is going to charge higher.
Really? Okay, so it's with the new,
That's a huge increase. But now, animal shelter personnel-wise, we filled everything, all this, right? We used to have very little personnel, and now we added more animal control officers, we added more kennel attendants, since the last few years, I'm talking about
maybe.
3-4 years.
Yeah, I don't know historically, but, so I can speak to that, so I can start with the personnel if you want at the animal shelter. Okay.
Amy, before you
Yeah.
we move on to personnel,
Sure.
how are you doing with retaining the ACO?
Um,
That was an issue at one point in time, which is why we
Mhm.
added him, so.
Yeah, part-time, so we made full-time.
Absolutely. There's one ACO that may just be changing careers, but generally, right, they're happy with, I think, being full-time, salaried, and, or full-time and with benefits. So I think that makes a difference, Brian. So that's why we actually would like to get one full-time kennel attendant this year. We cannot find, first of all, the kennel attendants are paid like $14.60 an hour, which is, extremely low, and it's a very difficult, job in terms of, like the noise and, it's just, they're cleaning out the kennels and,
That's the OPEIU contract that AFSCME.
let's see, I believe it is OPU,
$114.
yeah. What was that, Brian? Yeah, I believe it's OPU. So the only problem is we'll probably have to create a full-time title, because right now it only listed as a part-time job. Like, there's not even a full-time salary range.
I think we used
And-
to have a lot of volunteers too, kennel attendants.
There are volunteers, but
Is this are you going to take 2 vacant part-time positions and combine them?
exactly, yeah,
Okay.
yeah, that's what I want to do.
With the
Right.
benefits and all. Yeah, we have to budget for,
Yeah, yeah.
and the benefits, yeah.
And then the other problem is that there's really no administrative support at the shelter. I think at one point Liz had a choice between a vet tech and an admin, and she picked the vet tech because it's an animal shelter, but she really needs the support. And the volunteers, there's a bunch that have left that have been there a long time, so we really need someone like answering the phones, coordinating what volunteers they do have, like a solid presence at the front desk, and we just don't have that right now. So that's the other, and then that would just be part-time. So then I'm just kind of working backwards. Senior services, Maja, we had talked about making the social worker a permanent.
Yeah, it was a
Yeah,
Township,
Township,
now
right.
you wanted to make it. Senior services, I was telling Mr. LaPointe the other day, some of the council members, especially I know Mr. Russo and probably Miss Lori Price Abrams, I do not remember.
Okay.
They asked us if we can earmark the opioid, it's cannabis revenues for senior services.
Okay.
Is that still discussion, or if it is, we have to dedicate it as a dedication by rider?
I wasn't aware, I wasn't privy to that, so I.
That's not been a recent discussion, but I can talk to them.
Okay. Yeah, no, that would be great.
If that is the case, then, all these budgetary
Mhm.
personnel.
But that's just,
matters and
we
all.
only received the $250,000.
Right, right,
so
if they want additional
Assuming some of the
personnel.
other licenses move ahead, we would get more money, but,
Yeah,
yeah.
yeah, those are, the other licenses were
Mhm.
issued like 6 months ago, I guess, but there is no movement.
Yeah, it's complicated.
Yep, yep.
Right. So then senior services, because we had hired these people, 2 staff members on the grant's gonna end. I'm hoping to keep one part-time
If the
person.
grant ends, let me ask you this, if the grant ends, grant comes for a specific program, the program, for example, I'm giving a very bad example
Yeah,
here,
yeah.
probably Ebola or COVID.
Right.
If those programs finish,
Mhm.
then the nurses who work on those programs, they don't have work. So what happens?
Well, they have all their regular statutorily required work, so that, they always have that. It's just that they take on these extra things when there's specific grants.
I thought the regular is, we have budget funded nurse positions, and the additional nurses come with the additional programs.
So mostly what I've seen since I've been here is that the existing nurses, we just use the grant money to offset the, position, and then they take on that additional work. So say for COVID, right, we didn't hire a bunch of new nurses. They were the ones doing the contact tracing and the outbreak management and.
Yeah, the overtime was paid for by the CARES Act funding.
Right.
Same thing, some of the nurses, which we pay through the grants.
Okay.
Their time has to be accounted for. Their function has to be accounted for that grant. That's the only way we can use grant monies for that work. So that's our separated functions.
Right. So you're saying just in terms of the paperwork, like,
No, the work
The
for
actual-
that health program.
okay. All right, so we'll talk about that more,
Yeah.
but, so, and then as far as, right, so grant money, basically we have $1 million or so right now in grant funds that I think by June will all be gone, the end of June. We have
How much did you say?
$1 million.
So strengthening health capacity, they do, so
That
that's a
almost-
state program, right? So the
It
program
was
is
federal
from-
money funneled through the state.
Right, so we are
CDC
not
money.
going to do any strengthening public health capacity work?
I don't think that that was really a COVID-focused grant, and as far as we've heard, that they don't think is going to be refunded. The other money, the larger amount, the $550K,
That's a leg.
we may have a no-cost extension. That was that last email that came through. So if we have any money left, we'll be able to use it beyond June 30th, but it doesn't look like there'll most likely be any additional funds.
That's what my question, if the additional
Yeah.
funds, that those programs are cut, so the program work is not going to be there anymore.
Right. Yeah,
So
well,
personnel need
for
those.
strengthening, yes, because we hired specific outreach people, right? So we have 2 people on that grant that are both grant hires, right? So they won't need to do that work, right? So those positions would end. With the enhancing local public health infrastructure grant, which is the $550K, that's a little different. That was an infrastructure grant. So you could hire a social worker, you could hire an inspector, it was a way to build up capacity in health departments, and then the intention is that the township or the municipality then keep those people on, because, the work,
The
infrastructure
infrastructure
we
we need.
Got
Yeah.
you started, right?
right, I mean, to get ready for the next catastrophe, whatever it may be, So, because for years, we've been underfunded, local public health. And there used to be public health priority funding, that was just money that municipalities got that had like no strings attached. It was just like a constant stream from the state, but it got voted down. So we don't have that on the horizon. So it wasn't just municipal money, but it was state money, maybe a small amount, but at least it was constant, so you could count on that. And then the last piece is the personnel for public health, for core public health, which is nursing, environmental, and health ed. So we have a part-time health ed position on the books, but I would like to make that full-time. And this person would support all the different divisions, senior services, sustainability, the shelter, whoever needs, anything related to health education. It's very hard to find a part-time health educator, particularly because, they've gotten their master's and they've passed their CHES exam, and they want full-time work. This is their profession. So it's been very hard. They've had, I think, 3 different part-time people over the, last several years. And for, serving, it'll be after Nutley leaves. Right now, we have 100,000 residents we serve. It'll be 70,000. That's still a significant amount. And, we need to have at least one person for that. Let's see. Then the other thing is, and I talked to you about this, Mr. Lopolo, inspections. So right now, we have 2 full-time inspectors, health inspectors. We have 174 restaurants, risk 3s and 4s, which are like your typical sit-down restaurants. We inspect them 1 time a year now, and 174 is a very large amount of restaurants, very densely packed in here. So we really need to do 2 inspections a year. Statutorily, we only have to do 1, but it doesn't mean that best practice isn't to do 2. We're finding a lot of people that are, restaurants that are conditional or just really not keeping up with some of the things they need to do. So we're going to, 1, do an education campaign, and then 2, we're going to do more surveillance and enforcement. I also would like to hire someone that's bilingual in English and Spanish, because we don't have anyone in that group that can speak Spanish, and that can be a key component. I want to start doing food handler classes in Spanish as well as in English, and do a lot more of those, because I think after the pandemic, people first there was a lot of turnover, right? And then there's just not as much, people just were doing less inspections, less, things in person. So I think we need to really ramp that up. And I think that's it. That is it.
Thank you.
Thank you. Any more questions? Thank you, Amy.
Okay. I have a couple of capital things, but I don't want to keep you guys.
Yeah, we also we're working on a fleet,
Okay.
comprehensive fleet solution.
Okay, good.
So
Yep, that's one of the, and then I got a few other odds and ends, but
It's okay.
thanks.
Perfect timing.
Tony, is IT?
No, it's fire department's thing.
Oh.
Sure.
Hold on 1 second, sir.
Okay.
Mr. LaPola, you're live.
Okay, next will be the fire department. Chief Herman, you want to introduce who's with you, and then we will proceed with your presentation.
Certainly. Good morning, Mr. LaPola, Ms. Rao, Ms. Ockmall, everyone in attendance from the public. Thank you for being here. I'd like to introduce Deputy Chief Rob Duncan and Deputy Chief Brian Wild. We're going to present our budget request for 2024.
Go ahead.
So I'll start with the operating budget, and there are increases to our request in our operating budget, mostly due to our request for the staffing that we've been requesting for some time. We're asking for the personnel to be placed back in our department that were lost pre-pandemic and due to budgetary reasons. And so we're asking for those members to be replaced so we could get our department back to full staffing. So I'll start with the increases that we're requesting. First is in our fleet maintenance. We're requesting funding for the specific reason that one of our engines, which is due for replacement, due to the pandemic and problems with getting parts and everything, an engine that would normally take about a year to receive is going to take approximately 3. So that engine will most likely incur some extra cost for maintenance due to its age, and so we're asking for an increase in that for that reason. Our education and visual aids line, we're asking for an increase, and that is specifically, mostly for the members that we're requesting to be replaced. So there's a cost for the fire academy, so that number will increase. Also, the fire department, as I mentioned in the past, is an all-hazard response agency. There are many things that come up that we need specific training for, and one of them specifically is lithium-ion battery operation. So we are taking steps to increase our members' knowledge. We need some SOGs written on how to operate at those type of incidents, and that's why the increase there. Uniforms and clothing, again, point to the increase in personnel that we would request, and that would be for their protective clothing, for their uniforms and the like. So that would be the increase in that line. Electronic and communication maintenance, that increase is due to our radio system being included in the state system. And that increase would be, there's a subscription cost for each radio that we would be receiving. And that is a bonus, an added feature that our department will have, and gives us more operational efficiency. Special equipment maintenance also. We have new equipment dealing with a lot of the things that the department has to respond to. And this will be to replace equipment and maintain equipment that we've had to accumulate over time for all of the aspects of firefighting and special incidents that we respond to. For an entrance exam, we're requesting funding, so that is why there's a request in that line. And also, we had received a grant for the Assistance to Firefighters grant, a federal grant, in the amount of over $300,000, and that increase is for the matching funds that are required to when in receiving that grant.
Did you have questions?
I have questions.
Okay, good.
So everything seems like it is driven because of the staffing. You're requesting additional staffing. For the last few years, I guess, your staffing is 76. That is the current organizational chart from your department that I have is 76. That 76 is the one that you applied for Glenridge for the shared service agreement also. So last year, we added, for Mr. Lapola's information, last year there were 3 added because there were retirements, so you requested that they be trained because they are already in retirement. So that was, the goal was to come back to 76 at that time. So now, with the 76, recently Mr. Lapola changed one firefighter, removed one firefighter to captain, a training officer. So that's change in the organizational structure. Now we are requesting 11 additional firefighters.
Was it 76? I thought it was higher. Was it 76 or 78?
So we were at 79.
Right.
So we were given 3 additional firefighters.
Right,
We were at
that
76.
3 because of 3 potential retirement. That was the discussion at that time in the budget hearings and all that. The 3 were
If
because
you're
they were
replacing 3 retirees, that's not adding 3 people, that's just replacing 3 people.
Right, so eventually it's supposed to be going to 76 because there are a few months it was supposed to be a little additional 3 people, but it was going to go back to 76. And with the 11 new, I just want to know what services currently we are not providing because we don't have these 11 firefighters.
Well, if I would be allowed to just read something in regards to the budget hearings for 2023. So this is from our Mr. Beneke. With respect to the fire department, we had an employee count of approximately Okay. We had a employee count of approximately 89 personnel going back to 2019 and 2020. Today, that count is approximately 79 after Mr. Scantlebury indicated we add back 3 firefighters. So we were budgeted for 76, 3 more were added, which brought us to 79. So we are asking for our personnel to be replaced because there was no operational reason given to the reduction other than for budgetary reasons. And it's my understanding revenue is back up, the Glen Ridge contract has been signed, and we simply are asking for the members not only to protect our residents in the way that they deserve, but also to protect the firefighters who respond to these incidents. We don't just respond to fires, we respond to many different types of incidents, and we feel our residents deserve a fully staffed fire department, and we also believe our firefighters deserve this. So if I could use an analogy, if everyone would just bear with me for a minute, we all, we love our beloved Mounties. So I'll use an analogy where Coach Johnson wouldn't put a team out on the field that's understaffed. So we feel the same. We want our members to be safe, and we want to adequately protect the citizens of this township. And we're simply asking to go back to where we were so we could adequately protect the residents and our firefighters.
So Chief, you were at 88 or 89 in 2020?
Correct. So we were budgeted, we were given a budget for 89 personnel. So the staffing was reduced for the reasons I just indicated, and we're simply asking to get back to that for the reasons I stated.
Getting,
We're not this is not a question and answer, this is just a budget presentation.
I'm getting back to my question. What services we are not providing because we don't have these 11 firefighters now, currently?
It's not a matter of what services we provide, it's a matter of the level of those services. So there are NFPA guidelines that are recommended national standards. We were up to the minimum of that with 4 members per apparatus. We were budgeted for that, we were brought to that level, and again, our firefighters are going to respond, they're going to do the best job that they can with the members they have, but we need to get back to that level of service and protection and safety for everyone.
And what is your current overtime budget?
Our current overtime budget, I believe, was 1.25 million.
I have it. I'll let you know. Why is it now with the 11 firefighters adding, why are you increasing the overtime budget also?
Well, the same as, that
It's not
question came up last year. It's simply a matter of what we're budgeted for. So these are requests. That number went up due to contractual raises, so that was figured in. But again, Ms. Rao, we'd be glad to collaboratively work with you as far as whatever staffing we're provided. That number, of course, will change. But if we don't ask for it, we put it in like we said last year, as if we were given no members, our budget is going to be increased due to contractual raises.
So let me understand. So you are putting this, requesting additional overtime with the, in case the additional firefighters are not given. That's what you're saying?
Correct.
Okay. Okay.
So just let me get this straight. You you have minimal staffing requirements per piece of equipment that can respond. So, for example, on today's, explain to me how it would work. I know how it works, but explain to me for the public how it works in terms of staffing at, say, we'll use the firehouse at police headquarters,
Sure.
quarters. Who's there, how many pieces of equipment, and how you run a 24/7 staffing for the purposes of whether or not, if you don't have people, you're paying overtime.
Sure. So the minimum staffing per apparatus would be 3, and with so we have 5 apparatus. That's 15 personnel, and 1 tour commander who is the battalion chief. So that would be 16. That is the bare minimum that we can go down to.
Okay. So the cutting to levels below this is basically eliminating an apparatus or eliminating a firehouse, or how would that work?
Well, sure, that would just put us at dangerously low levels of staffing, and it would be a matter of what was considered as to what you want us to close.
16 times 4 is 64.
Correct.
64. How does it work in Cedar Grove or Westville? Do you explain how that works?
Is Westfield
Can I
you look at
respond or no?
Is it unsafe to live in Westfield? Because Westfield spends a lot less,
Westfield has 8 firefighters on duty.
and it's safe.
I'm not engaging the public in this, so you can continue.
Okay.
The organization structure that I got from you guys, I think, and it's the same one that's used for Glen Ridge, it has 76. Just the one change I recently made, because Mr. Lapola changed 1 firefighter to a
You mentioned that
captain.
twice already, yes.
Yeah, so I think there's some confusion as to we were budgeted for 76, and then that was increased last year to 79.
Again, in the,
Not what we were told. We were told there was substituting free because free.
We're not having a debate here. I just went on the
yeah, that was
the
at
website
March.
to the budget, to the budgets that are easy to read, and it lists the number of firefighters, so that's where I got the 79.
Yeah,
from.
for a partial,
That's what I got for
yeah,
part of the
partial
time.
time, because they were already.
But it's the end, it's not the beginning of the year was 79, it went down, it went from 76 to 79, once the budget was adopted.
Yeah,
So they go into this year with 79.
No, when they are on terminal leave, they are going to be on the books, so it doesn't go down until, but they're not there to do the work.
Okay, well, that's a whole other story.
What was that, Mr. LaPola?
I said the whole, in my opinion, the notion of terminal leave and people remaining on the books, so you're double counting a position, is something that we're attempting to address, and when someone leaves, they're gone. It is rendered a lot of departments here, I can't even describe how convoluted and complex it is, but the notion that you could have 3 or 5 or 7 people on terminal leave who are not here being paid, trying to fill vacancies, overtime goes up, and the number you're talking about is not a real number because 3 of the people are not there to do the work, they're just being paid. So we're trying to eliminate that across the board in government here in Montclair because it's not only cost ineffective, but from a managerial point of view, it's a nightmare.
Yeah,
So my
that's
goal
why
is to
we-
eliminate that throughout, if I do nothing else, we're eliminating that
Good.
throughout government here because it makes absolutely no sense. And I just, for the life of me, don't understand why it's here in the first place. So,
That's what we started in the beginning of the year, after we have the human resources director, then we wanted to change this ordinance, that the town ordinance, along with the employee manual. That's the time it started. Eventually, for the civilians, we were able to change recently, so effective January 1st, it's going to be good. So we will not have people on terminal leave, which is costing us so much more, which is not also in compliance with the laws. As for the police and fire, the benefits are like 37% pension, and
so,
it
and we're
costs
we're
additional
negotiating
50%.
with them to implement the same thing. So hopefully by the first of the year, we'll all be on the same page.
That will help the town
That's the goal.
taxpayers.
So, do you want to talk about capital budget? I have a question in terms of how, because I've talked to some other municipalities in terms of ordering these trucks that now have a 3-year lead time, and that is a problem that a lot of municipalities are facing. Is there any other way to do this besides
Ordinance.
financing it now and purchasing it in 3 years? I mean, I don't know legally how you would do it.
You have to do an ordinance, so.
And just for the
yeah.
entire amount for now, and
Yeah.
then the money set aside
Yeah.
until the 3 years it's
Yeah.
delivered.
And we were
Okay.
also discussing about, the, depending upon the number of engines, gadgets, we were going to do a comprehensive review of what is needed. I don't think it ever materialized.
Okay.
So as far as capital, we are requesting the replacement of Engine 1, which was due in 2023. The question, and Ms. Rao, we've discussed this, and we just need to, come up with a solution, is that, again, the apparatus wouldn't be paid for till its delivery, which is approximately 3 years. And the longer we wait to order it, the more the price goes up. So we just need to determine how we're going to get that in place, and we'll work together on that ordinance, and, we could get that accomplished, hopefully. We are asking for a pickup truck with a snow plow. So that is to replace one, our current one is, I believe, a 2008. And then our other one was actually, at the end of its useful life. We do need generators at Station 2 and Station 3, whole house generators. We are also requesting funds for exterior repairs and painting to Station 2. We're requesting funds for tools and equipment for the department. Station 3, as we know, is undergoing renovations now, and we're going to be requesting the funds to complete that project. And also, we have PPE needs. We are applying for the American Rescue Plan grant for that, but again, I don't know if it'll cover all of our needs or if we're successful in getting it. But we have been in the past. Hopefully, that stays the same. And that's all we have for capital requests.
But that grant, Chief, that ARP grant, it's almost like we'll get it. You apply, you get it. All the last years, you just have to change the dates and submit. I don't know whether the time is still there or not. I believe I sent you.
Yes, it's. I believe the period is into December. But again, what we requested last year, we didn't get. So it's a matter.
You did get.
No, we didn't get all of. I believe we may have requested about 75,000. I believe we got 24. So we don't get everything we asked for, but we did get something. So we'll do the same this year.
Every dollar helps.
Oh, absolutely. That's why we apply.
Mm-hmm. And the other $300,000 grant, we did get that FEMA firefighter grant,
We did,
right?
yes.
So we did get, and we provided the matching already last year. So the same $300,000 you will be getting again this year? You are
No,
going to apply for it?
that money, we didn't, that was not reflected in our budget, that funding. And so when you apply for those grants, you don't necessarily get them. I mean, the budget is over and passed. So when when the budget is passed, we may not be advised that we got the grant till, like, say, September, October, November. That could happen. So that's why we're requesting those funds to be placed in there for the match.
No, we did put the match and we got the grant. We already have the match budgeted
Okay.
and the grant came in.
I could discuss that with you. Maybe it's just not reflected in my documents.
Okay.
All right. Okay. Any other questions? Thank you, gentlemen.
So did you want us to speak on code enforcement also?
Sure.
Okay. So code enforcement is essentially a flat budget. Our staffing and the operational costs are flat. And capital-wise, again, we may need one vehicle for that department.
Aren't you requesting a full-time for code enforcement, another full?
Well, I
Full-time
thought that
lead.
was already in there as far as for the lead abatement program. So, again, if it is reflected in the request, so.
Yeah, you're asking for additional, yes.
Yeah.
One full-time, yes. And then 2 part-times you're requesting.
Right, and those are already included.
When?
They've been in the budget.
So for this year, for 2024, you are requesting.
Yeah, 2023,
Currently, we don't have a full-time lead inspector.
Right.
Currently, we don't have these 2 part-time temporary lead inspectors. So you are requesting for 2024 budget.
Yeah, they're not part-time lead inspectors. They were part-timers that were.
Inspectors.
They were included in the '23 budget.
Chief, with regard to capital, coming back to capital, is there any updates on the Station 3? I know recently Gary and I came and saw, and then by that time, you said you're waiting for this contractor to wrap up so we can do the plumbing and electrical work. That money is still there. That money we put in 2021, and for Mr. Lapola, I don't know whether he knows or not. It took us a long time to start the work, and now it's almost done, I
Yeah,
think.
I'm well aware of the issue, so I think the budgeted amount was 600 and something
It was
thousand.
500.
500, we spent
And-
260.
No, I'm talking about what you're asking for to finish the building.
It's approximately like 635,000.
Yeah, let's, once we do the plumbing, once we do the electric, and slowly we can but we have to start that work first.
Absolutely. So we're just waiting on a final meeting with the current contractor to finish up anything that's outstanding. And once we see what funds we have left, we will certainly put them towards continuing the project. But will not be enough to complete
I
it.
know, but we already have the vendor lined up,
Yeah,
the
that's-
co-op vendors for the electric and for the plumbing. So we have the vendors ready. We just want that existing vendor who is doing the outside, the structural work to finish so that we can
Yes.
do this work. So
Yes.
when do you anticipate that structural work vendor to
We
wrap
are
up?
tentatively scheduled for the 15th for a final meeting.
15th of this month.
Correct.
Okay, okay. Thank you.
John, I just have one question regarding the building stop. If you remember back, the last administration, that there was a rotation where we would never fall behind with the purchasing of the vehicles.
Yes.
Are we still on that rotation? Did we set up with Mayor Jackson and the finance committee?
Yes, so we had really made a lot of progress in replacing our apparatus, and engine 1 is the last one in that rotation. So it was, we were requesting it in 2023, and now we're requesting it again. The only difference is the time frame to receive it has changed tremendously. So once we get that, we'll have a really up-to-date fleet, and we're very thankful for that because, quite frankly, we used to respond with fire trucks that were actually falling apart. So we're very grateful to the governing body and to the township manager for getting us up to speed and again, being able to protect our residents and our firefighters with good equipment. So
This is the last one.
so this is the last piece. This is the last piece, and we're going to be in very good shape.
Brian, that was the one we were going to also put it in our negotiations with Glen Ridge. We were going to ask them to pay for one fire engine, so I don't know.
That would make sense. That would have made sense, right? Unless
We're not having this
Municipal said that
conversation.
Glen Ridge only needs to pay for the margin, and Montclair has to pay for everything, all of the principal.
Okay. Anything else?
Nope, that's it, unless there's any
Thank you
more.
very much.
All right, thank you.
We have 20 minutes until Alicia Dawkins comes down. So, and then we have that one, and then we take a break, and then we have the library and finance, and I think my department. Okay, good morning. We're going to continue our departmental budget hearings. We are going to have the Human Resources Department and Alicia Dawkins. And welcome back from vacation.
Thank you.
So you can give us a little presentation on your budget, and then we'll ask questions.
She's happy to be back.
I said to her this morning, it's like you never leave, right?
Okay. My budget is pretty much flat from last year. There will be a few increases due to the strategic hiring that we're doing. We're looking at 2024 to hire roughly between 29 to 30 new employees. And that's a combination of all the departments, which would include recreation, the police department, administrative staff, so just across the board.
Just to be clear, that's not new positions, that's people we are.
No, oh, I'm
hi-
sorry,
yeah,
no, that is not new positions.
Right.
That's due to the
Turnover,
retirement that
right.
we didn't have within 2023 through retirements and attrition. So as you know, you lose people, you have to replace the people so we can, do the work of the town. And with that, advertising costs have gone up over the year. So we will need to increase the advertising budget so we can continue to use posting on, the New Jersey Lead website that we use. Some positions we do post in the newspaper. So we want to continue to be able to reach a broad audience for our advertising. You'll see an increase in the physician fees, and that's due to, again, the evaluations that we must do for the fire department and for the police department in terms of the pre-screening. And again, because of the hiring process, we will need to have funds available for those troops so the employees can go for pre-screenings.
That's for new hires only. Now, we don't
That would only
screen-
be for new hires only. And that is actually a little bit lower because what we did for 2023, not all employees need to have a full medical screening. So we reduced that cost by not sending every employee to have a full screening, only depending on the need of the role. But we do need to break out the budget for the physician fees and what's currently allocated for professional services. So all the medical fees should be on one line item, so we know exactly what we're paying for.
For professional services fee, I understand this is for, other than the IMAC, for helping with the
The
health
insurance,
insurance
health insurance.
enrollments and all that. The other one is your attorney fees, right, for the labor
Correct.
attorney?
So included in the professional fees, we have the employee professional services, which is the EAP for employees. We have the labor attorney fees included, and then IMAC insurance services.
The labor, Mr. Burl, on Wednesday, his presentation, he mentioned it could be going back to his department. We are not sure, and I need to have a discussion about this. The situation was, Mr. Rapola, it used to be in the law department, but the law department never dealt with them. It used to be budget in the law department, but the manager's office
It
directly
may wind
dealt
up in
with
my
it.
department, but I think.
Labor?
Yeah, I think the issue is becoming just to have a better grip on all legal fees. And-
Yeah,
And having it centralized would be much, in my opinion, much more efficient. So that's the conversation. It's not specific to performance in a department. It's just that we have,
Okay.
we have lawyers all over the place, we have insurance all over the place, and we're trying to bring all of
So-
these things together. So, but that decision has not been made. The
Okay.
cost is not going to vary. It just basically would be where council will be
sits.
based out of, but they would perform the same function for the department.
Okay, so
Yes.
labor, I would still, just hypothetically, still have that partnership with working with the labor
Yeah, you
attorneys?
would.
or
Of
is
course
that
you
go-
would. No,
okay.
you would.
Okay.
But the negotiations, I think we have some big negotiations that should be starting.
PBA.
PBA.
Yeah,
Yes,
so we
PBA is
have to
starting, yes. We
prepare
have to start that
ourselves.
within 6
and
months.
assuming I'm still here, I will play a major role in those negotitions.
Absolutely.
other than the salaries and wages, the professionals we hire, attorneys are the biggest.
Yes.
That's the highest of all the outside professionals. Attorneys in many divisions, many departments, and
Well, we need a
predominantly
labor
in the
attorney.
legal department, a lot of attorneys. Okay. So that's, Mr. Lapola has to decide,
Okay.
eventually, so who is going to be, and when he says like a consolidating, or I don't know the plans, I have to discuss with them depending upon that. But I can, overall, the township, Mr. Lapola, overall, the township attorney fees, how, usage of attorneys, I should say, the amount spent on attorneys have ballooned over the last few years.
Yes, they have.
Yeah.
And that happens periodically. If there's lawsuits, et cetera, they will go up, and some years they go down, and that's how it works. And I've,
Thankfully,
I'm an
the
attorney
last-
myself, and I have been dealing with this, whether in the county government or the Turnpike Authority, and this is
Maybe there is.
not
maybe
Well, you
uncommon.
can understand, I don't mean to cut you off, Ms. Rao, but I'm only speaking for the HR department. So in terms of the labor fees, they were a little bit high due to the ongoing cases that I walked into that were here for about 3 or 4 years. So, but other than that, the labor costs from a day-to-day process, I wouldn't say would have
Yeah.
had
No,
an
so- but
impact.
we're going to have a comprehensive issue, a comprehensive plan in terms of how we deal with
And the
all of
internal
those.
work, who does the internal work and how much we rely on the outside consultants, and that also, it's a discussion we need to have, because
Internal work as in,
some of HR work, some of law department work, and some are outside consultants.
well, I do my own work, Ms. Rao.
I think she's talking about how much departments rely on outside counsel in the course of the day, and as a result, you're paying for that service. Is it better that we hire 1 or 2 more people in the law department as opposed to paying outside attorneys? Those are issues that we have to address.
Yes, that's
Okay.
what I meant exactly.
that's really what we have to address.
We have a request of $500,000 in the law department, which is, in the last 8 years I'm here, it was never there.
Understood.
Your staffing, you are requesting additional staffing.
Yes, I am requesting 1 additional part-time employee. And the reason for this request is just due to the amount of work that we have in terms of reporting and annual reports. So again, we're looking at this. It's not concrete. I think it's just more of a safety right now. And I've been working with Mr. Lapola to determine if there's truly going to be a need for that, or will I just, take on more of the workload versus bringing on someone new. But we would like to have that option.
Can you state for the record, just so people understand, how many people currently work in your department?
Currently, I have 2,
Including you, 3.
well,
There's 3 people.
including me, 3, but for a township this size, it's usually 1 HR person for every 100 employees that you have.
So we have
No, yeah.
350, 300, we usually have 350 full-time employees.
Well, we have to include the part-timers as well.
Okay.
Okay.
And not to mention the temporary staff. As you know, during the summer months, we roughly have like 100 to 125 recreation employees, which is, although they seasonal staff, they still have to follow the same guidelines.
We have to do an organizational restructuring. We have to look at the organization. Job descriptions haven't changed. We discussed that. So we have to do all this. Then we come up with, who needs to have what. Many departments are understaffed, including finance.
I think their hearing's a little later today.
Yeah, I know. But again, the budget law budget law caps us from increasing the budget by not more than 2.5%.
Well aware.
When the salaries are increasing, 3.25% increase in the salaries, right? This is only salaries, not even the step increases. And that eats up majority of the budget. That's the reason for over the years, I guess, all the many departments, especially after COVID. After COVID, there was a freeze during COVID. I remember specifically, not remember, I know because the tax collector's office, we interviewed, we were about to give an offer to an employee. We just written up the offer, and the COVID happened, and we never hired that person again. We were like trying to do all this organizational restructuring to do where the money is.
Well, that's with a few departments, so there were a lot of departments where people left, or again, through attrition, some of the positions were not filled. So it's not necessarily that the budget
Yep.
is increasing, is you're backfilling the positions that were never filled from the beginning.
I agree.
Yeah.
I'm talking about the overall budget.
Yeah.
There is a cap of 2.5%.
Any other questions? Thank you.
Thank you.
All right, our next, I think we have the library at 12:30, then the courts, then you. So we'll take a break until 12:30. It's an early lunch today.
Ready or not?
You are, sir.
Okay, good afternoon, everybody. This is a continuation of our departmental budget presentations. Our next presentation will be the Montclair Public Library. I'm going to turn it over to Janet Torsney to make our brief presentation.
Great, thank you very much. I've handed you out my material so you can look at it too, but I want to let you know this budget has been approved by the Board Finance Committee, but the full board won't meet until this evening, and I assume they'll approve it, but if there's changes, I'll let you know. Our funding request, we're requesting $432,850 in additional funds from the township, and we're matching those funds with $516,000 in projected gifts, grants, and other income. Our total 2024 budget, so that would include the state mandated funding, the township mandated funding, is $4,546,827. And that ensures that we'll be able to provide excellent services at both branches. So the why we are requesting additional funds. We've had remarkable growth in this last year. I know you all know that libraries, growth in libraries tends to be incremental. It's very unusual for your traffic to double in 1 year. 200,000 visits is really a lot of people. We cover throughout all 4 wards of the town. We're very proud of that. Also, our program participation doubled and circulation increased to 50%. And there's some things like the Bellevue Avenue branch, traffic increased 8 times, and children's circulation doubled. So there's extremely healthy response to the library. And we found that the more we do, the more people want, and the more they use the library, which is as it should be. But our staffing is still at the level it was in 2021. So our new budget includes 4 new full-time positions, 2 part-time promotions to full-time, and 13 new part-timers. We tried to be, the number of part-timers, I think, is an indication of how we tried to be abstemious and conservative in our request, but we just need more people. To give you an idea of what these positions are, one is a bookkeeper. Currently, the comptroller is the only person who does all the financial everything financial involved in the library. So that is not a good idea, and it's also unfair. So a bookkeeper, the adult school, which raises almost $100,000 a year and has classes that are attended by tens of thousands of people in Montclair, actually only has 1 full-time employee as of now. So we're hiring an office manager for the adult school that will manage the classes and whatnot. A custodian, there's only 1 full-time person in our securities and facilities department. Weekend assistant, so we can reliably open in the weekend. Social worker, so we can expand services to unhoused and other people. And an outreach specialist, so we can do more outreach to people in the community. With this, we get pretty much constant requests for programs like ESL, GED, daytime programs for adults, additional teen activities, story times in different languages, expanded adult school and author talks. And these additional staff people will make all that possible. It will also ensure that both buildings are safe and adequately staffed. So the second reason, aside from staffing, is our buildings need attention. Maintenance has not been a priority. So our 2024 budget includes regular maintenance and replacement of some outdated systems. For example, our security cameras are outdated. And we had done a desktop exercise with the police, fire, and EMT, where they said it would really be so much better for them if we updated, and then they could just patch into our security system, which they can't do now. So that kind of thing we're doing. And we'll also continue to look for savings. We had LED lighting installed through RMC and PSE&G that was a $100,000 value. So we did that this year. We'll continue to look for those kind of things. And innovation, our utilities costs are huge. So we've been looking at solar power. We have a really good roof for that. Is that a way we can cut those costs? We've also been reviewing all of our agreements and procedures for savings wherever we can. So our plans for 2024, I expect this growth will continue. We have had a really good partnership with the school. We want to have library cards for all the teachers and all the students. We're starting next year with a big community read. I hope you all will be part of it too. I think that will be an exciting way to promote reading throughout our town. We're going to continue to reach out and respond to community ideas. We're very excited about the part-time social worker who will be a complement to an internship program we've been doing with Montclair State, and is actually going to be funded, this particular position is going to be funded by a foundation grant. Water infiltration issues at the branch and improving the courtyard, those will be priorities for us. We always want to reflect Montclair's diversity in our collection, our programs, and our staffing. And we want to expand the adult school. And we, in this interesting, not print media age, we have really interesting plans on ways to reach new audiences and people who get their information in different ways from the traditional adult school. Finally, we really want to focus on, we are proud to be a heating and cooling center, but we feel that we're not as reliable as we should be because of our very old HVAC, which is over 20 years old. So we want to look at repairing the roof, replacing the HVAC, and providing generators for both buildings so that we can be a reliable heating and cooling center. And we're working on the pricing for that now. And then I helpfully included the prior year too, so you could compare. We changed, in the expenditures, we changed our budgeting system. For some reason, the library, the only department that had a budget was the adult school, so we switched over so that each department has a budget. So that's why there's some blank columns on each side, but it's simplified and better management. So you can see where the costs are going up, our payroll and utilities in the building. Those three things are our biggest expenditures. So that's what questions,
Can you,
thoughts?
because we are broadcasting, thank you very much, on television, can you just review the statutory process of how the relationship is between the library and the municipality?
Sure. The Montclair Public Library, like all public libraries, is funded on a statutory regulation of a third of a mil, which is related to real estate taxes. So there's a mandatory amount that each township pays to support its public library. And then there are very generous towns, like Montclair, New Jersey, provide additional funding, which in our case is necessary because we have our two-branch system, and one building, as you know, is very old. So if you look at our budget, we really couldn't sustain what we do, all the programs we do, without additional funding. So that, of course, is optional. The other mandatory, the state, if the library meets certain regulations, there has to be a director, you have to have a certain amount of training and things like that, then the state will also provide a certain amount of mandatory aid. Yeah.
Have you sought state funding for capital improvements?
This is part of our scheme for 2024. We had talked to, actually, particularly Mikey Sherrill's office, about ways we might be able to access environmental funds by doing some sustainability work, particularly on the main building, if we could be kind of a model.
I'm talking about state money. Wasn't there a bond issue?
Oh, yeah. Apparently that was before I was here, and there was maybe a misunderstanding about whether the township would match it, or I'm not really sure, but
right.
They didn't apply. And this year, the new...
I live in Union County, and there are several communities that built new libraries.
It's so painful. And I have a friend who, what their town, their library applied for was a new HVAC system. Mm-hmm. But, so I wasn't here, I don't really know the ins and outs. And now the new state librarian actually is trying to do those things more often, because now it's been about once every 30 years, so her belief is it should be more frequent and continuous. So she did do that, actually, but this year it's only for certain municipalities, and we don't fit the context. I believe it also has to be health-oriented. But yes, we're on it.
So just to be clear on the appropriation, so the mandatory appropriation pursuant to the tax calculation goes up a little bit less than $300,000. Mm-hmm. And in addition to that, you're seeking $432,000.
Exactly.
Okay.
Your additional appropriation request you're requesting from the town is actually going down. The additional appropriation you're requesting from the town is going down.
I know, I'm trying to be very, very cheap and abstemious. And, we've been lucky with our other fundraising too, but, I know you all have priorities, and we're trying not to be crazy,
Mm-hmm.
And your facilities budget actually is going down, facilities and security. That I was surprised.
Right, because we've looked at some, we've renewed some of our contracts, and we found some savings. That's an area where we have found savings. But it's still, it's a lot. That the utilities and the facility and security are big expenditures for us.
Your building is relatively much better shape than all our township buildings, so,
That's true.
With regard to the small library there,
The branch, we
the
call it.
branch library, the CDBG funds, I discussed it with our planner, and there is a possibility to get some CDBG funds for that ADU. Is it a lift, elevator?
Oh,
But we can't do this fancy elevators or something, right? It's only small,
Mhm.
depending upon what. There is a possibility, Talk to her.
great. I will, thank you. That's Janice,
Only
right?
because of it, this is Americans with Disabilities related matter. Otherwise, that branch would not have been qualified for CDBG, but the purpose of work is what makes it qualified.
Oh, great. And since we had talked about it, someone pointed out to me on Plymouth Street, the curb, there are 2 handicap parking spaces, but the curb isn't wheelchair friendly. Could
In
that be part
Plymouth
of it
Street?
also?
Plymouth? Oh, in front, on the other side of the
Mhm.
library. It's possible.
Okay, so I'll
That's
check with her on
possible
both
too.
those things then.
Yeah.
Great, thank you.
Is there currently an accessible curb?
We
Crosswalk?
added an additional space, so I believe, I think the
With the
additional
spaces,
one,
I was
yeah.
going to say, I thought they would have to, okay. Okay.
Janet, one question. The foundation used to be very robust and active in the fundraising. How are they doing?
They have committed to give us $150,000 this year. So I think they're doing well. Their annual appeal is out now, so that's a very big thing for them. We're hoping more. We always want more. And they have our agreement with them, too, is that they give us a certain amount of money for the year, but then grants that we get during the year, they pass along those directly to us. So that's been helpful.
Thank you.
Sure, thank you.
Okay. Well, thank you very much.
It's my pleasure.
Thank you.
We try.
Enjoy a little tea break or something, right? And so this year, do you expect the budget to be finalized in
Full steam ahead.
We are significantly delayed in everything. We still don't have access because of the IT-related matter. So it will have a ripple effect to closing of the year. It depends upon how the closeout of the year happens.
All right, thank you very much.
Thank you.
Have a good day.
Take care.
You're welcome. I'll be in touch with you all.
Are we live or are we? Ooh, Donna, you have big increases.
Mr. LaPola, you're live.
Thank you, sir. Good afternoon, everybody. This is our next session of departmental budget presentations. Our next up is Donna Benyon, Court Administrator for the Montclair Municipal Court. Donna, I turn it over to you.
Okay. Good afternoon, Mr. LaPola. Nice to meet you. I'm here on behalf of, or in addition to Judge Angelo, who unfortunately couldn't be here today, having a prior commitment. But our budget for the municipal court is pretty straightforward. It's a smaller budget on average compared to other departments. And this year, we had a slight increase, an exact amount of $2,770, which is not a significant increase, and that is attributable to the line item for professional services, where I needed to budget more primarily for Judge Angelo's vacation time, to allow him to, exhaust that time this coming year. I met with him and said, Judge, I think you need to allocate for that, and he agreed. So
this is, you pay a per diem to judges who cover the sessions?
Mr. LaPola, yes. So we have a judge, we have court Tuesday evenings and then Wednesday morning and afternoon. So those are two sessions considered, the Tuesday evenings at 4:30, and then on Wednesday, we meet at 9 a.m. and at 1 p.m., but one judge will come in on Wednesday to cover both sessions, and that cost, the amount that they're paid covers for both.
Sure. Do you find that revenues are picking up again, or are they?
Yeah, slightly. I mean, obviously during the pandemic, our revenues did go down, but I did do a count, and our revenues, for 2022, we generated over $1 million to the township for 2022, is what my records show. And so far for this year, we've generated $1,037,000 to the township. So, we're doing pretty good. I mean, staffing levels that I do have, I know this is only operating expenses, but as far as staffing, there are 2 vacancies that have yet to be filled, but.
How many total employees?
10 altogether, and there's 2 vacancies.
Okay.
So I'm right now on the fence of filling it because our ticket issuance has decreased over the past year. So I didn't feel the need right now to fill those vacancies. I did fill one retirement that occurred in November of 2022, but other than that, the other 2 vacancies remain open. So, so that's, basically it. That's the only significant increase that I spoke with Judge Angelo about, and also we have our in-person interpreters that come in that we budget under professional services as well. And recently this year, we've had a few sign language interpreters that needed to come in, and those are quite costly.
So are you almost all virtual now?
Pretty much, yes. We have court one Wednesday a month, and that's for our more complicated cases, DWI matters that require an in-person disposition because there's paperwork that has to be filled out, driver's licenses that have to be retrieved from a defendant so that we can return it to Motor Vehicle Commission. So it just makes it easier if we have that person coming in. And if the judge feels that the person, a lot of times I can make a decision that people are not very well versed with utilizing Zoom. So we have them come in person because, we try to help them out that way. They don't have to struggle in utilizing the platform so that their case can be heard and hopefully resolved on that day. So, but other than that, I think, the amount is very minimal. And like I said, it's attributable to the amount that I budgeted for the judge's vacation time.
Sure.
So hopefully that's all good.
Yeah, all good.
All good? No questions? That was easy.
That's it, okay.
That's it. Thank you very much.
Okay, you're very welcome. Thanks so much.
Please
Nice to
tell the
meet
judge
you.
I said thank you.
Okay, I will. Thank you.
See if we're off. Just quick.
If you like, sir.
Okay, good afternoon, everyone. This is a continuance of departmental budget hearings for the Township of Montclair. Next up will be the Finance Department.
Good afternoon. I'm glad to be here to present the Finance Department's budget. Oh, sorry. Good afternoon, everyone. I'm here to present the Finance Department budget. Just like you have seen all other departments present their budget requests, this is a request, not a final budget. Let's see how you already saw many departments request increases in their budgets. Those increases, along with their regular spendings, everything touches the finance. All of their operations touch finance because of their revenues or expenditures or in, other items, grant applications, etc., etc. So what that means, any increase will have a ripple effect that comes through finance. In addition to supporting, the finance department, one of the big functions of the finance department is to support the other departments' operations, to help them perform their operation to the best of their ability. In addition to that, finance department functions are also statutorily set through the statutory responsibilities of the CFO. The CFO's responsibilities are set in the statutes and the regulations, NJAC. And so the department is in a way guided through those statutes and regulations. These statutes and regulations, the purpose of these is to protect the taxpayers. That said, our finance department has various divisions. Upstairs on the third floor, we have the finance administration, accounting and treasury, and purchasing. Finance administration encompasses everything. That includes all these three divisions upstairs, and in the first floor we have the tax assessor and the tax collector. With regard to the finance overall budget, the only changes you're going to see is actually, it looks like a big change. The change is services, professional services or data processing services, whichever you may call. Actually, they come under data processing services, like the finance application softwares and the payroll services, armored car service, etc. So these used to be part of a different negotiation. Finance department regularly looks for various, how do I say, the best value for the taxpayer dollars. That's how we regularly look for opportunities to renegotiate with vendors. One of it is our banking services. When the township funds are invested in the banks, it earns revenues, interest. Sometimes the bank gives some other offers in such a way that they may pay for certain services, and they may reduce their banking fees or not charge us the banking fees. It's a part of the negotiation. A few years ago, when the interest rates were like 1%, 2%, at that time we had, we went out for an RFP, we got the bank services, we negotiated, and we got the deal in such a way that these credit card, financial application fees, payroll services, armored car services, and some of the credit card fees, they're all picked up by the bank, kind of netted out of their revenues to a certain extent. That was very beneficial to us when the interest rates went down really, like last year, year before, the interest rates were so low, but because of this agreement, they were honoring this. But now that the interest rates are going up, we have to, look at the we were looking at our contract and renegotiating. So now all these costs associated with these services are going to be picked up by the township, but we will also see a corresponding increase in the revenues. The interest rate side, you will see on the revenue side of the budget in on sheet 4, you will see the increase in the bank interest. And on the expenditure side, on sheet 12, you will see the increase in expenditures. That's basically only for these items, data processing services. That's in the finance, tax collectors to a certain extent, and distributed among the finance divisions. Other than that, nothing new. We annually go out for our professionals. We do through an RFP, and we award it at the end of the year. Let's see how it goes this year. We advertise, and soon we are going to, the advertisement will end, and of the proposals that we receive, we are going to evaluate and see where we land at. We are not anticipating any increases. And with regard to personnel, let's go back to professional services. The bigger professional cost for us is the tax appeal attorneys. That is done through the tax assessor's office. That is one of the, again, Mr. Lapola said that these attorneys will be consolidated or looked at, centralized. So this is still under conversation. What else we have? Did I forget, Nada? Did I forget anything else? Personnel. Personnel is, there are some open positions that we haven't filled in the last couple of years. That is because we are reassessing our department and see where the needs are. Many of these titles were like, they weren't changed in the last 20 years or so, and they don't fit our needs currently. And we also wanted to see where our need is, because there is a clerical position open and the revenue department doesn't mean we need that clerical position just automatically refilled. We want to see where we can combine some of the activities upstairs in the finance, accounting divisions, and some to be distributed among the other divisions. Because of that, we did not fill the position immediately. We were analyzing. In the meanwhile, we got some temporary employees to see actually where we need is. We recently realized that we have a strong need in the financial analysis aspect of it. That's where we have the shortage, and we also need help with the purchasing department. Laws are changing regularly. The number of vendors are increasing because of the activities of the other departments are increasing. The procurement aspect is under tremendous pressure, combined with the governor's executive decisions during COVID, and even the recent ones like Russia-Belarus laws. All those things, they affect the finance department. The revenue collections wise, the super utility revenues collections part was under significant stress because of, again, the LIVAP rules, and where they have to help the residents guide through the application, state application. These are some requirements that we strongly have a need to reassess and refill positions, maybe not in the same, most likely not in the same level, but different level. I feel like we have done that now, and we have a pretty good idea of where the needs are. That's going to be the personnel requests. Anything else? The biggest thing that the finance department does, not just helping pay the bills and procure the vendors, etc., etc. One of the big parts is the oversight of all township finances, which by that I mean like we have to provide the accurate reporting, accurate records and timely reporting so that this helps the residents and the governing body make proper decisions.
Can I ask a question? How many positions, you mentioned positions that you had not filled? Are those funded positions this year?
Yeah, 2 are funded positions. I'm asking for additional 1 more position.
Okay, and then my other question is, how many other positions are there that are funded that have not been filled at all this year? Not in your department, but townwide.
That's why I responded to you. I have to sit with Alicia to see what positions are open this time.
Okay, because I don't think those lists match. 'Cause
Match with what?
I got a list, I think there were 9 vacancies on the whole list, which didn't make any sense to me.
Ah.
So,
You know, we have every year, along with the budget, we submit the number of positions funded in each department. I thought I gave it to you recently.
I'm just
Yes.
trying to figure out what's vacant.
I wouldn't know. Today it could be vacant somewhere, something in the municipal court. I don't know, but I will sit with Alicia. She can pull the report in Prime Point that gives positions. Yeah, timely reporting, that's what I'm very concerned about this year with the cyber attack. We still don't have access to our files, our data, so we are, once we get access, we have to gather up the data, we have to close out the year. Closing of the year, we usually start in November, and right now we don't have access to our pilot files and pilot data, pilot contracts, and many others. We don't have access to Section 8, we don't have access to the parking files, a lot of, we are just in limbo. This, it delays our closing. The closing delays means we don't know where the township stands financially at this time. Once the year end is over, when we close out the accounts, then we know what's the situation, financial situation of the town. And then that helps with budgeting. Yeah, and another item is bond issue. We were going to issue bonds this summer, and so many things happened, and again, the cyber hack is a big reason. We did not issue debt. We must issue debt as soon as possible. Sorry. The internal controls is a continuous affair with finance department. That takes up a lot of effort, anxiety, and personnel too, because we have to regularly monitor these. The reason for it is that's how the taxpayer funds are, we can say, it's properly looked after. And when the rating agencies they'll look at how are the, do you have this report, that report, how timely, how quickly, and any in the audit reports, do you have any comments and recommendations? Our goal is not to have any comment or recommendation.
What rating agencies do you usually use?
Standard & Poor.
Okay.
Standard & Poor. And we, these all have the effect on the taxpayer dollars because, because of all this is reflected in the, good internal controls reflect in the good audit report. And good audit report and the timely reporting reflects in the bond rating. We got the lowest interest rate in the state of New Jersey at one time. This is something to be proud of. This is because of the operational efficiency and focus of the finance department and the other, township departments too. It's a big part. And that takes up a lot of time. That needs personnel. We have to be regularly in compliance with all the budget laws, bond laws, fiscal affairs laws, procurement laws. Procurement laws are ever changing. It's for the good of the town. And the regulations, the local, federal, state regulations, and the grants. Many of the grants come with its own compliance requirements. We have to be regularly monitoring those. Township gets a lot of grants. Thankfully, good, many of the departments apply for it, and the grantors are really, we get the grants because we show our finances in a good way. We are like, accountability is there, transparency is there. We post all our contracts online. We post our labor contracts, we post our whatever contracts that the town enters into. As soon as the finance department gets it, posts it. And we have the bills list online. This is all important.
Okay.
My opinion.
Well, I want to ask you if you have any questions of yourself, so.
Many.
Welcome, I always welcome questions.
Yeah.
When people send me an email, I respond quickly, and I'm actually
Okay, I
happy
think
about
that's
it.
it.
Yes, they are funds.
Okay, I think we'll take a break till 2:30. My presentation will be very short. And then we will, I think, just the clerk's office after that. And we have a meeting tonight, so. barely. Good afternoon. This is a continuation of the departmental budget hearings for the Township of Montclair. The next budget to be presented is mine, and I will briefly just go over some of the changes that have occurred. I couldn't present numbers because it wouldn't reflect with the movement of Channel 34 to IT, and then we have the split of responsibilities that formerly belong to the communications director. We do have a new communications specialist who will start next Monday. We also have a second administrative assistant in my office. I also want to congratulate my administrative assistant, Alexis, on the birth of her daughter, Viviana. We wish them very, very well, and she is missed during this budget process. We are considering creating other positions in the office, but that will be determined once I get a better sense of the overall budget and the needs of other departments. It is my intention to just overall consolidate some of the legal fees, counsel fees that we pay to outside parties, just so we have a better sense and to avoid overlap, and hopefully we can have some savings here. But other than that, it's a very small department, so I think that's basically, right now where we are. I think all the accounts, except for, I think, I don't know what the line item is called, but I would like to have an increase or an overall amount. We have, the counselors during the course of the year often would like to have, different issues studied to see possible projects, et cetera. So I want to have a specific line item so that we know where we can pay for those particular studies, and some consultants. So that's basically where we are. I guess there's no questions. Okay. Thank you.
Don't forget the grant writer.
I'm
We are
waiting
doing
to
a
see.
grant.
This will be the last presentation of the day of the departmental budget. From the clerk's office, I turn the microphone over to Angelise Bermudez Nieves. One of these days, I'll remember to put the microphone on when I speak. I'll turn it over to you, Angelise, to give a brief description of what your budget looks like, and we'll take it from there.
Okay, thank you, Mr. Lapola. I have Ms. Dominguez with me. She's the Deputy Township Clerk, and we've prepared a budget. Under the clerk's office, we take care of our operating expense, the Township Council, and the election. So there's 3 different budgets. All 3 of them are virtually flat. We didn't ask for any increases, with the exception of professional training and development to allow for the deputy clerk to take classes. And the election also, the county has advised that there's going to be an increase to the amount that they bill the township, so we've requested an increase in that line. Outside of that, everything is flat.
How many elections are there?
Next year, there will be 3.
3 separate elections.
Yes, sir.
Okay. And that increases how much? 30,000?
30,000,
That's what I thought.
which may change because there's 3 different county offices that bill, and we haven't heard back from all 3. So I'm trying to
The Board
get
of
an estimate.
Elections, the clerk,
And the superintendent of elections.
that's separate from the Board of Elections.
Yes, sir.
Okay. Any questions? Nope. Nada? Nope. That's it. Thank you.
Thank you.
Thank you.